Welcome to the deep dive. Today we're getting into kidney damage. You sent over some really great sources. And our plan is basically to unpack the essential info, what causes it, what to look for, what can be done, without making it overly complicated.
Exactly. It's
Yeah.
crucial stuff. Your kidneys, they're working nonstop, like these amazing filters cleaning your blood.
Right.
But if they start having trouble, waste products can build up, and, well, that causes problems system-wide.
Okay, so let's dive in. What are the main culprits? What actually causes kidney damage?
Well, probably the biggest one we see is diabetes. Consistently high blood sugar over the long haul. It just damages those tiny blood vessels inside the kidneys.
Like kind of gums up the works.
Yeah, that's a good way to put it. And right behind diabetes is high blood pressure.
Ah, okay. That makes sense.
If it's not controlled, that constant pressure weakens the kidney's blood vessels too. Just puts too much strain on them.
The sources also mentioned infections. Is that
Right.
more serious than just a standard UTI?
It can be, yeah. If you get frequent UTIs,
Mm.
or if an infection actually travels up to the kidneys, that can cause direct scarring and damage, not just a temporary thing.
Okay. And kidney stones, they seem pretty common.
They are. And if you get them repeatedly or have really large ones, they can actually injure the kidney tissue.
Ouch.
Yeah, or block urine flow, which creates pressure back up into the kidney, also damaging.
Now, this one was interesting, even stuff you buy over the counter, like painkillers.
Yes, that's such an important point.
Yeah.
Things like NSAIDs, ibuprofen, naproxen, if you overuse them regularly, they can be harmful.
Really?
Absolutely. Same goes for certain antibiotics and, believe it or not, some herbal supplements if not used correctly. Always follow directions or, check with your doctor.
Good to know. And then there's family history, right? Some people are just more predisposed.
That's correct. If kidney disease runs in your family, your own risk is unfortunately higher.
Okay. And the usual lifestyle suspects,
Uh-huh.
alcohol, smoking.
Both heavy drinking and smoking mess with your blood circulation. And good circulation is absolutely vital for your kidneys to function properly. So yeah, those definitely contribute.
So given all these potential causes, what are the actual signs? What should you, be looking out for?
Well, the tricky part is that symptoms can be kind of vague, especially early on. You might notice you're urinating less or maybe not at all in severe cases. Swelling is a big one, like in your face, legs, ankles, hands.
Okay, swelling.
Feeling really tired all the time, persistent fatigue, nausea, maybe vomiting, feeling short of breath sometimes, even just losing your appetite.
Wow. Okay. That covers a lot.
It does. Other things can include really itchy skin, or sometimes the skin takes on a sort of yellowish tint.
Right.
And some people notice they have to pee more often, especially waking up at night to go. Or maybe their blood pressure suddenly goes up.
It sounds like these could easily be mistaken for other things.
Exactly. That's why awareness is key. If you have concerns, especially if you have risk factors like diabetes or high blood pressure, it's always best to get checked out.
Makes sense. The sources also mentioned stages of kidney disease. Could you briefly explain that?
Sure. It's basically a scale from 1 to 5.
Yeah.
Based on how well the kidneys are filtering waste. We measure something called the GFR, glomerular filtration rate.
GFR.
Yeah. Stage 1 and 2 mean there's some damage, but kidney function is still relatively okay, maybe just mildly reduced. Stages 3 and 4 indicate more moderate to severe loss of function. And stage 5 is what we call kidney failure or end-stage renal disease, ESRD. That's when the kidneys have pretty much stopped working.
Okay, stage 5 is failure. So what happens then? What are the treatments?
Well, for earlier stages, the focus is really on slowing things down, managing the underlying cause, like blood sugar or blood pressure.
Right.
Lifestyle changes are huge here. Watching your salt intake, sometimes limiting protein, drinking enough water, but not too much, definitely avoiding smoking and excess alcohol, keeping a healthy weight, getting some exercise.
And medications play a role too.
Oh, definitely. There are specific blood pressure medicines, like ACE inhibitors or ARBs, that help protect the kidneys, medications for diabetes control, diuretics to manage fluid buildup, maybe iron supplements if anemia develops, which is common.
And for stage 5, the kidney failure stage.
That's when you need kidney replacement therapy. The main options are dialysis or a kidney transplant.
Dialysis is the artificial filtering.
Exactly. There are two main types: hemodialysis, where blood is filtered through a machine, usually at a center, and peritoneal dialysis, which uses the lining of your belly to filter waste inside your body, often done at home.
And transplant is getting a new kidney.
Yes, receiving a healthy kidney from a living or deceased donor. It's often considered the best option for quality of life, but it's major surgery and requires lifelong medication to prevent rejection.
Got it. So thinking preventatively, what are the key things people can do?
Regular checkups are probably number one.
Yeah.
Keep tabs on your blood pressure, blood sugar levels.
Yeah.
Get routine urine and blood tests as your doctor recommends. Checking for things like protein in the urine or creatinine levels in the blood.
And the lifestyle stuff we mentioned.
Absolutely. Eating a balanced diet, using medications, even over-the-counter ones, responsibly, and treating infections like UTIs promptly so they don't get a chance to spread to the kidneys.
So really, looking at everything from the sources, it feels like overall health and kidney health are just incredibly interconnected.
They really are. It's quite striking how managing conditions like diabetes and high blood pressure directly protects your kidneys. And, even small habits matter.
Like the painkiller thing you mentioned earlier.
Exactly. Just being mindful of how often you're taking something like ibuprofen could potentially save your kidneys a lot of trouble down the road. It's these connections that are so important to understand.
That really makes you think. So here's a final thought for you listening. Considering all these factors, from diet to medication use to managing existing conditions, what's maybe one small, manageable change you could focus on right now that could have the biggest positive impact on your kidney health long term? Something to mull over. Thanks for diving deep with us today.